A day as registered nurse Sydney in Australia. Let's come and listen what we go through every day. Normally, if I work in the morning, in my shift in the ward, we start at 7 a.m. So I usually woke up quarter to 6 because my house is nearby the hospital. By the time I prepare myself, it only takes 5 minutes to get into the hospital, so I'm a bit convenient. If anybody work in Sydney in the hospital, try to find the accommodation nearby the hospital. But if your house a bit further, you have to prepare a little bit better because of traffic in the morning. I'll get into the ward. We start to receive handover from the night duty nurse. So normally we allocate the patient 8 to 10 patients for 2 registered nurse to look after in my ward because we are surgical ward. So we receive handover, we say hello to the patient as we normally do. We go through all the care plan and everything. Anything priority, we will do the priority first. Any patient have to get ready to go into the surgery or the OT, the operation theater, we have to get them first. So this is a routine in the surgical ward, and a lot more things happen. All the team in the ward, they will start to come, the junior doctor register the consult. They might start at 7:30 and we sit and do their round about 7:30 or 8 o'clock. So the plan to look after the patient will be according to what they plan in the morning. As the registered nurse in the surgical ward, we make sure that everything get ready before individual patient we go to the operation. This is roughly what I'm sharing with you. So 8 hours for our shift in the morning, quite busy. We got a lot of team involved in each patient, and then we need to pay more attention and priority which one we have to get it done first. So 8-hour shift is not long at all, and then we work at the team. So the multiple team that we have in the world, they can be contain the physiotherapy, the occupation therapy, the social worker, and the doctor team, and more team if one patient got a few team involved. In this case, you need to know that what you have to priority first. For example, in the morning, any medication have to be withheld. We're not gonna give it in case there might be effect when they have an operation in the theater. So we need to be clarified and confirm with the doctor team. And other thing, what other case that we have to check with the patient when we prepare all the paperwork for pre-operation. Is the patient have any danger? Is there any pin on the needle or anything we need to record? So if you want to become a registered nurse in the surgical ward, it's particularly you have to learn how to look after patient pre-operation and post-operation for the patient in the surgical ward. Today, I just share in the morning shift that my day will be gone quick. It's not even look at the time at all sometimes. So what I done after I woke up, I prepare my breakfast. I bring my breakfast and my lunch. Has no time to go to the coffee shop to buy anything. So I have a quick breakfast. We're gonna go and have a morning tea or as a breakfast for us about 9 or 9:30, and then we come back and take turn. Later on, we have lunch properly before we hand over for the afternoon shift. Sometimes at 12:30, sometimes at 1 o'clock, depend on how busy it is. And after that, you make sure that you drink enough water. You go to the toilet because of you might hear a lot of nurses got diagnosed with the bladder infection, so the urinary infection, because we hold the bladder, we didn't go and empty our bladder, or we didn't do wee enough. So be aware of that. You have some time to go to the toilet and drink enough. This is some of experience that I have in my ward. By the time everything go to, I don't even know that this is 1 o'clock already. This is 2 o'clock already. So the afternoon shift gonna start about 1:30. We talk about afternoon shift, what we gonna do tomorrow. Morning shift, when it start, we need to make sure all the observation get done, care plan, medication. Any other team have to be assess the patient, dietitian, and everything like that. This is for example, they have to be involved in the multiple team to look after individual patient. If any patient post-operation, you have to monitor closely because another side effect or something may be happen. So don't ignore any sign of the post-operation patient. So if you want to know that what area you want to become the nurse or registered nurse, they look after patient in different criteria of your ward. If you look after the patient at an elderly aged care, you don't involve a lot of the operation assessment. You involve with the aged care or the medication or other diagnose that the patient admit into aged care ward. So we totally different. I ask yourself today, your day will be gone so fast and you not even know, oh, 8-hour shift is gone. So time to go home and look after our family at home, cooking, cleaning up, and then go to bed. And next day, if you in the morning, you repeat the same thing again. Generally, sometimes people can have morning shift, afternoon shift, and night shift. They will be rotated. We don't have a certain shift for 5 days. The hospital in our ward, we rotate the shift. Sometimes I can be in 2 morning shift, or maybe PM shift, the afternoon shift, and night shift. Normally, full-time staff in my ward, we're gonna do 4 night shift in 1 month, and morning and afternoon shift, they will rotate us to take responsibility. And everybody, when you start in level 3 RN nurse, you have to start to do in charge in the ward, which is quite busy, so we call nurse in charge. A lot of things that you need to be aware when you do the nurse in charge. Take responsibility as a teamwork, and then you have to communicate effective with other team, and about discharge, admission paper, and admit patient into the ward, allocation staff, or the medication and other things that will be contained for the nurse in charge to take responsibility. Today, if you want to be the registered nurse in Australia, especially in Sydney, in the surgical ward, this video might be good for you to have a bit of experience and listen, and you got some idea. Do you want to become a surgical nurse? Good luck, everybody. Don't forget to subscribe Nurse Jong in Australia, and you won't miss out the good video. Thank you.